You're watching EAC News. Thanks for joining us. The Ministry of Health released a statement on Monday reminding all people who will partake in preparations for ancestral offerings in upcoming festivals and ceremonies to be careful about the possibility of transmitting bird flu from animals to people in the community. EAC News reporter Robin Lim has more details.
The Ministry of Health stated that every year, some people partake in making various offerings during ancestral ceremonies, with the purchase and circulations of birds being a major aspect that may increase the risk of bird flu transmission in the community. The H5N1 strain of the bird flu virus in the animals and in the environment have been known to infect humans at any time if not properly prevented. The ministry urges people to continue their personal vigilance and duty to avoid direct interactions with livestock, animal at farm and poultry markets, entering slaughterhouses or making contact with surfaces used to cut poultry or other animals and which could thus be contaminated with the virus. The ministry also reminded citizens to be careful about congestion and crowds when buying food, poultry and other materials, and recommendations going a few days early to buy materials in advance to avoid the crowds and markets or shops on the same days of ceremonies. They also called on authorities to set up surveillances and guidance units at live poultry markets to oversee the implementation of preventative measures to curb the spread of bird flu in their communities. In addition, the ministry urges people exhibiting bird flu symptoms such as having a fever over 38.5 degrees, cough, difficulty breathing, and a history of contact with sick or dead poultry at least 14 days before symptoms began to call the emergency number 115 and rush to the nearest hospital. Bird flu is a variety of influenza caused by infectious viruses that can be spread among not only birds but also humans and other animals. The H5N1 strain is the most common form of bird flu. The disease is dangerous to birds and can easily infect humans and other animals. According to the World Health Organization, H5N1 was first detected in humans in 1997, and 60% of those infected with the disease have died. The Ministry of Health in Cambodia declared the first case of bird flu in the country in 2005. And from 2005 to 2014, Cambodia recorded 56 cases and 37 deaths from the disease. Robin Lim, EAC News.